In this video, we will be discussing about the most common mental disease and psychiatric illness, which is the depression. According to the research from World Health Organization, WHO, more than 264 million people are affected, and close to 800,000 people die due to suicide from depression every year. Suicide is the second leading cause of death in 15 to 29-year-old. We must have good knowledge about depression, if it is affecting us or any of our friends or family, so that we can figure it out and seek for treatment as soon as possible. Before starting the video, please subscribe to our channel and hit the bell icon to watch our videos. We make health and fitness related videos twice a week. Let's see what the symptoms of depression are. The first and foremost, the most common symptom is sadness. During depression, the patient gets very sad. Even if there are positive things happening in their life, they can't feel happy. They feel sad every time of the day for weeks, months, and even years. From this kind of sadness, we can figure out the difference between sadness from depression and sadness in our normal life. In our regular life, if we feel sad due to our normal problems and ups and downs, those sadness immediately fades away if something good happens in our life. If we are sad due to certain problem and if that problem gets solved, then we will be back to normal. Whereas, the sadness from depression is such that, even if there are very good things happening in their life or even during festivals or various occasions, the patient cannot feel good or happy. This is known as the persistent and pervasive sadness, which is seen throughout the time in the patient. The second symptom is lack of interest. There will be major loss of interest in the life of patient. It may be in their hobby, job, study or relationships. They don't feel to get involved in any activities. Patients tends to say that they don't feel happy in any situation, and also, they don't feel happy doing the things which they used to like before the illness. The third symptom is the excessive guilt. Patients feel a lot of guilt during this period. In every situation of their life and every small problem of their life, they start to blame on themselves and feel that they are the reason for every wrong thing which are happening. The fourth symptom is physical weakness. Patients always feel low in energy and weak throughout the day during their everyday activity, even if they are not having physical work. The fifth symptom is lack of concentration. If the patient is student, then they are not able to concentrate during their studies even if they try very hard. Also, people who are working cannot focus in their job and regular activities. The sixth symptom is change of appetite. In large number of cases, patients don't feel like eating, and there is a huge loss of appetite which leads to major weight loss of the body. But in some minority cases there is increase in appetite which can lead to weight gain. The next symptom is insomnia. Patients suffering from depression have trouble to get asleep. Sleeping time gets shorter and patient can hardly fall asleep. There is a proper pattern in disruptive sleep during depression. For some patients they can't fall asleep for 2 to 3 hours after going to bed. And for some patients they may fall asleep, but the sleep doesn't last for long, and the most common one in depression is that patients tends to wake up very early than their usual timing, which may range from 2 to 3 hours before their regular waking time. Similarly, the next symptom is to have self-destructive thoughts. Patients often think about giving up on life. They think that there is nothing left for them in this life. Suicidal thoughts are often seen in the patients. And if anyone is facing such symptoms from 2 to 3 weeks, then it can be due to depression. These types of symptoms are seen if the patient had a certain problem in his life. But the interesting fact is that these symptoms can also be seen in patients who are not having problems in their life. Even if everything is normal in their life, but suddenly they can suffer from depression. So, depression can even be felt without any cause and mishaps in life. Now, let's see the causes of depression and why people suffer from it. This illness can be categorized into two different groups. First is the biological cause, and the second one is the psychological cause. Biological causes are those where there are changes in different chemicals of our brain which lead to these symptoms. There are basically three chemicals which are serotonin, norepinephrine, and dopamine. If these chemicals are depleted in our brain, then the symptoms of depression are seen. In the physiological cause, if any person faces a major negative situation or problem in his life, which hampers his brain, then the patient tends to evolve many negative thoughts, and such thoughts provoke the symptoms of depression. During the phase of depression, The patient tends to build negative mindset and only feels negative vibes in every situation. For example, if a person is trying to learn new things and if he is not able to do so, then the first thought in his mind will be negative, such as, I am not able to learn, I have no skills, I can't do anything in life, my future is very dark. That means even in small things of life, they start to build negative thoughts which will lead to deep sadness. So, the biological and psychological causes are the main reason for depression. Now, what should we do if we or someone around us faces such difficulties? The first thing we should set in mind is that no one in this world intentionally gets depressed. Many people fear or feels ashamed to tell someone that they are depressed. They feel that they are very weak from mind or person as they are suffering from depression. Depression has no relation with mental strength or weakness. It is not that the people who are suffering from depression are mentally weak. The first thing that we must do, if we are suffering from depression, is that we should not feel that we are weak or build any negative thoughts about us, and also, we should not feel guilty for the situation. This is just an illness, we should treat it as we treat other illness. There are two ways for the treatment, which are the medical methods, in which there are medicines which helps an increase in serotonin, norepinephrine, and dopamine level in our brain, and also helps and improve our moods. And another way for the treatment is counseling. In this method, patients are given counseling in psychotherapy sessions. In such sessions, the negative thoughts which are evolving in patients are identified, and they help patients try to change or replace those thoughts with good alternative thoughts. Both treatments are very beneficial, and the best result is gained if we combine both the ways: medical treatment as well as counseling. So, if you are facing such problems, or anyone close to you are facing such problems, then we should not waste time and immediately seek for treatment. Depression is such an illness which can be treated, and we can be fully recovered from it. If we feel depressed, we must visit our nearest psychiatrist as soon as possible for the treatment. Therefore, these were the symptoms, causes and treatment for depression. Hope you enjoyed the video. If you liked the video and thought it was useful, then please like and share. Also, don't forget to subscribe and hit the bell icon for similar videos. Thank you.